my name is Carrie Weiser, student practical nurse, and I want to talk to you today about UTIs, which is urinary tract infections. They are infections of the urinary system which affects the ureters, the bladder, the urethra, kidneys, and even the prostate in gentlemen. They are also known as bladder infections. There is cystitis, urethritis, and prostatitis. An upper UTI refers to conditions such as pyelonephritis, which is inflammation of the kidneys, pelvis. There are several things that causes UTIs. It is known that women are at greater risk than men, and these are the most common infection in humans. The causes for females is short urethra predisposes, the close proximity of the urethra to the rectum, decreases in estrogen levels, sexual intercourse, frequent use of feminine hygiene sprays, tampons, sanitary napkins, spermicidal jellies, poorly fitted diaphragms, hormonal influences within the vaginal flora, synthetic underwear and pantyhose, wet bathing suits, frequent submersions in bathtubs and hot tubs, and even pregnancy. The alkaline urine promotes bacterial growth. Stool incontinence, bladder distension, urinary conditions, residual urine is one. Possible genetic links, even diseases that are caused by diabetes mellitus is one. And even one of the number one caused hospital-acquired infections is UTI due to indwelling urinary catheters. That is because whenever the urinary tract is sterile, so whenever the indwelling catheter is inserted, it can also carry bacteria with it. So that is one of the main causes that we try not to use indwelling urinary catheters unless it's absolutely necessary. In older adults, there's an increase in the risk of bacteremia, sepsis, and shock. Incomplete bladder emptying from an enlarged prostate or prostatitis in males, bladder prolapse in females, and sometimes that's a pretty common thing, especially if you've had kids. Inability to empty your bladder as a result of a stroke, Parkinson's disease, fecal incontinence with poor peritoneal hygiene, which means if you're an older patient, even younger patients who are incontinent and need to be changed. Sometimes they don't get changed quick enough, or they don't get cleaned good enough, and the feces can get into the urethra, and the bacteria from that can cause UTIs. Hypoestrogen in females affecting the mucosa of the vagina and urethra, which causes bacteria to adhere to the mucosal surface of the urinary tract. Even renal complications increase due to decrease in fluid intake. So we highly encourage to drink plenty of fluids, especially water. The signs and symptoms, there's quite a few. It could vary, but there is quite a few that actually usually happen. The lower back or lower abdominal discomfort and tenderness over the bladder area, nausea, vomiting, urinary frequency and urgency, dysuria, bladder cramping, spasms, feeling of incomplete bladder emptying or retention of urine, perineal itching, hematuria, which is red tinged or coffee colored urine, pyuria, which is white blood cells that are released into the urine sample, fever, voiding in small amounts, which means then you will have to urinate frequently, nocturia, which means getting up at nighttime to use the restroom several times to empty your bladder, urethral discharge, cloudy or foul-smelling urine. Your urine should not have any tint to any cloudiness at all, and it should not have any smell. In older adults, it does a little different stuff to them. One of the main things, if you're anybody older that you come in contact with, that your mother, your father, grandma, grandpa. If they are never confused and then all of a sudden they become pretty confused, I would have them check for UTI. Confusion is one of the main things. Incontinence, loss of appetite, nocturia and dysuria, hypotension, which means low blood pressure, tachycardia, which means increased heart rate, tachypnea, which means increased respirations, and fever. Those are indications of urosepsis, which is a very serious thing. The tests that are used to determine a UTI after these symptoms have been noted are a urinalysis, which means they take a clean catch urine sample, and if there is a urinary catheter, then they take a sterile sample from the urinary catheter. Then they do a urine culture and sensitivity, and what that is they send a sample to the lab, and they do a culture on it to see the exact type of bacteria that it is. Your white blood count and differential that is done, they take a blood sample, and they check the white blood counts because if it's higher than normal, that is a good indication of an infection. And they want to take a sample to rule out any sexually transmitted infections because these can be manifestations of a urinary tract infection. The diagnostic procedures that are done is a cystoscopy to help determine the cause. And they use like a scope to go up in your urethra, and they look through, it's a camera, and they look through it to see if they can find anything. A cystourethoscopy is to detect strictures, calculi, tumors, and cystitis. An ultrasound to detect cysts, tumors, calculi, or abscesses that possibly could be there. A transrectal ultrasound is to detect prostate and bladder conditions in males. The medications that are used to treat UTIs is mainly antibiotics. They use broad spectrum ones to treat until the culture and sensitivity comes back to verify the specific bacteria. Sometimes the antibiotic that you are put on at first will not take care of the specified bacteria that the culture comes back with. So they will sometimes have to switch your antibiotic to the correct one that will treat that bacteria. Sometimes it gets a little aggravating, but it has to be treated. And then they use phenoxypyridine, and it is a bladder analgesic, which means it's like a pain medication for your bladder, and it helps with pain when you urinate. It also scares sometimes because it will turn the urine red to reddish orange color. And if you are prone to have UTIs or you have them quite frequently, it is a good suggestion to drink at least 3 liters of fluid, which is 3,000 mLs of fluid daily. Water is the best thing. You can drink cranberry juice to decrease the risk of infection. A compound in cranberries might stop certain bacteria from adhering to the mucosa of the urinary tract. But if you have chronic cystitis, do not drink cranberry juice because it will irritate the bladder. Make sure you bathe daily and promote good body hygiene. Empty your bladder at least 2 to 4 hours instead of waiting until your bladder is full. Urinate before and after intercourse. That way there's no bacteria going in, it's coming down. Empty your bladder as soon as an urgency. Do not hold your urine. Go void ASAP. Females, as you are, we are at higher risk than males because of everything that we have. So you need to wipe the perineal area from front to back, not back to front. Avoid using bubble baths and feminine products, toilet paper containing perfumes. No perfumes. Avoid sitting in wet bathing suits. And avoid wearing pantyhose and slacks or tight clothing. And be careful when you take baths very frequently. Hot tubs, anything like that can get bacteria to go up through your urethra. So it's best to take showers. There are complications of a UTI. There's urethral obstructions. There's pyelonephritis, which is inflammation of the kidney, pelvis, chronic kidney disease, urosepsis, septic shock, and death. This is a very serious thing if it's left untreated. Who would think that a UTI would cause septic shock or death? I never thought that. So make sure that this gets treated as soon as possible. If you have any questions, just let me know. Thank you.